You have 3 major blockages and 1 minor blockages, so probably 4 bypasses. And your aortic valve is quite stenotic, okay? That's one of the valves in your heart. That means it's very hard and calcified, which is common in people that suffer from renal failure. Those valves tend to get very, very hard. And when they get hard, normally the leaflets open wide every time your heart beats to allow the blood to leave your heart, go into your body. Yours have become very calcified and are very stiff. So instead of opening up freely and letting a lot of blood out, yours only open up a little bit every time your heart beats. And your heart's having to work very, very hard to push that blood out to your body.
Is that just why recently I'm just, when I stand up and walk a little bit, I get so tired and
Yes.
cannot breathe?
Yes, both of those problems cause that symptom, okay?
It wasn't that long ago, yeah. And
This process takes years to develop. It takes a long time to get blockages in your heart like this. It takes a long time for that valve to get calcified. But once it gets to a certain point, people go from feeling okay to not feeling good at all. Okay, and
so what did I do? My foods that I eat that get it calcified?
no, it's mostly in your situation. It's the kidney issues. Yeah. Are you diabetic? I can't remember. Yeah, the diabetes as well contributes to that.
Yeah.
Those are the two things that have led to this problem. And unfortunately, when they did your heart catheterization, where that blockage in the artery is, it's a very difficult spot to try to stent without blocking off major arteries to the heart, causing a heart attack. And the fact that you need the bypasses and the valve done, even though it's a little bit higher risk because of the diabetes, because of the renal failure, you're going to be best served with surgery, okay?
Okay.
Rough couple of days ahead of you, I'm not going to lie. Surgery hurts. It takes a toll on your body. It takes a toll on your heart. You're probably looking at 2, 3, maybe 4 days in the ICU, and then probably a week and a half in the hospital, okay? Depending on your mobility after surgery, we may talk about a short course of rehab instead of going home. We want to make sure when you do go home, you're safe to do so.
So how about the breathing part? How long does that take before I can breathe normally?
We're going to want you breathing normally as quick as possible. So for most people, we're able to get the breathing tube from surgery out about 4 to 5 hours after surgery. And then after that, you're breathing on your own. It hurts a little bit to take a deep breath because we go through the breastbone to do this work. So there's been an incision and we cut through that bone and then we wire it back together. Early on, when you breathe, it moves that bone and that hurts some. But obviously, we want you breathing. And that pain gets better pretty quickly, okay? We put some drain tubes in to drain fluid away from the heart and lungs after surgery. Those generally stay in about 2 to 3 days. Once we take those tubes out, it becomes a little easier to take that deeper breath. The pain's a little bit less because you don't have these big plastic tubes rubbing on the inside of you, okay? So it does get better, okay? But it hurts. I mean, nobody likes having heart surgery, and it sounds like you didn't really want to have heart surgery, but you thought twice about it, and here you are. So, okay, and we wouldn't be offering this to you if we didn't think it would help you, okay? And we understand that there's risks involved, and your risks are a little bit higher than our average patient just because of your medical health history and the things that have gone on in your life. But those are acceptable risks. Left untreated, one of 2 things would happen. You would have a big heart attack. That would either take your life, or your heart function would reduce to the point where it would unable to pump enough blood out of that valve, and you wouldn't be able to do anything. I mean, even just standing up may cause you to pass out. Or those blockages would get worse, that valve would get worse, and you would develop heart failure, where the heart muscle becomes very, very weak. And the same thing happens. You just can't get up and move around, okay? And it sounds like you still have some living that you want to do. You're not ready to call it quits yet, I'm assuming. So, this ends up being the...
I'm assuming because that's why I'm here, I guess.
Yeah, exactly. I figured you and your family have had time to talk about that and answer those questions. Otherwise, you wouldn't have shown up today, right? So, we're going to do everything we can to keep those risks low with surgery. But like Dr. McKellar said, it's not a zero risk, especially in your circumstance. Okay. That the dialysis, the kidney issues, the diabetes, the fact that your aortic valve doesn't work well at all, your mitral valve doesn't work great either. We think it works good enough that we're not going to do anything with it. But
can I ask another question?
Sure.
Oh,
Hi.
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 We're just here from ultrasound.
Can you give me 10 minutes?
You got it.
Thank you.
Sorry.
Oh, definitely. They'll come
One
back.
question that I can think of right now is, so I didn't even know about the aorta one.
Mm-hmm.
So how long does it take that to develop?
Years. That's been going on for years.
Okay.
So, but
So how come I didn't know about it?
because
earlier?
most people don't know about it unless you go to the doctor and somebody all of a sudden hears a heart murmur. That's how oftentimes they're found early on. Other than that, you end up having to get to the point like you are where all of a sudden you're getting up and you're short of breath when you try to exert yourself. You know, instead of being able to walk around the block, you can only walk down the driveway. Those type of things. Something happens to your ability to perform that makes you pay attention to it. And then people start looking. And we're good at looking at things. You know, you come to the doctor, we'll find something, right?
Okay, that was my question.
Okay. Today is a big preparation day. We'll get some labs, x-rays, EKG, urine sample, all those things that we need to do to get you ready for surgery. They're going to come do an ultrasound of your neck arteries. I want to look for blockages in that location. People that have bad blockages in the heart can get blockages up here, and that can increase stroke risk during surgery. That's why I want to look at it. And I'm going to have...
that have anything to do with sometimes feeling pain here? No?
Probably not, no. That's just age and use and
Okay.
sore muscles.
All
But
right.
and then I'm going to have them look at the veins in your leg because we're going to take a piece of vein out tomorrow to do the bypass work
Because
with.
they did that on my leg, yeah. What is that called?
They did an ultrasound?
No, the angioplasty.
Angioplasty
On my leg.
in your legs? How long ago was that?
No, before COVID.
Before COVID? And did you have poor circulation in your legs?
Yes.
You had blockages in the arteries? Did they do both sides? Do you know?
Yeah.
Where did you have that done?
Dr. Reddy's office in Sandy.
In Sandy? Dr. Reddy?
Yeah.
Okay. But they did it in the office?
In office,
They didn't
yeah.
do it in a hospital?
No, in
So I might have trouble finding. And your legs have been okay since then? Any pain, cramping sensation in your legs when you go for walks?
No, it's my feet. I have neuropathy. It's
Okay.
numb, so, but it's cold all
Your
the time.
feet are cold all the time? Okay. I might have them do an additional study to check the blood flow to your legs. Okay? I think that would be good information to have if you've had angioplasty to the legs before. Okay? Have you had any vein strippings?
I don't think so.
Varicose veins? Treatments for varicose veins?
No.
Looks like you have a couple here. Nobody's ever taken veins out of your legs before?
I think he
that's
glued it.
after I had.
He glued it?
Yeah.
After I had the angioplasty.
Okay. All right.
Because I have one here too.
Yeah, okay. And you think they use some type of a glue or sclerosing agent? Okay. Do you remember if Dr. Reddy was working on the arteries or the veins of your legs? Or not sure? If you're not sure, that's okay too.
I don't know.
Okay. We'll figure it out.
Thank you.
Okay.
Would they have the records?
Probably not. If he did it in the office, we wouldn't have those records. That's why I was asking if it was done at a hospital. Then I'd have a better
Can you
shot of
call
finding
them?
those things. I can try. Okay, but it's probably not going to change what I do. I'm probably still,
okay.
even no matter what he did, I still want to look at it to make sure it's
Yeah.
still working properly. So we'll look at both things. Okay. So like I said, first couple of hours are going to be pretty busy. Okay, they'll be checking your blood, X-ray. They'll do the ultrasounds that we talked about. I'm going to have them put some blood pressure cuffs on your legs to check how well the blood is flowing down to the feet. We'll do those
If
things.
it's cold all the time, probably not that good.
Probably not that good. That's why we want to take a look at it before we take you to surgery, okay?
Okay.
Do you have any loose teeth or teeth that are infected?
My teeth have all been breaking.
Okay.
I came out, a couple of them came
Yeah,
out.
a couple of them came out. Give me a nice big open smile. Okay. Oh, yeah, you got a couple that are broken off there, kiddo.
Mm-hmm.
Okay.
I started chewing my food and then I found
And then found it breaking off.
Yeah,
When's the last time you saw a dentist?
I don't remember.
Long time?
But I was thinking of going,
Uh-huh.
but then I was afraid because then I started not breathing well.
Yeah.
And so I thought, okay,
Yeah.
I better wait until
Better-
after because I
after.
had to be on the chair and
Yeah, have problems with breathing.
Yeah,
Yeah.
my blood pressure's been
Believe it
very,
or not,
very
we go
low.
to Mexico to do our teeth.
Mexico to do teeth? Okay. No, probably a lot less expensive down there.
Yeah.
Yeah.
Yeah, I understand that. All right. So nothing to eat or drink after midnight tonight. That's very important.
Oh, I ate. They
Good.
told me to
Tonight.
eat.
You can
Tonight.
eat now. just after midnight tonight.
Tonight.
Okay,
Oh,
you can
okay.
eat till midnight. Don't have anything to eat or drink after midnight. Okay.
Okay.
They'll give you some medicines to take it with a small sip of water tomorrow. Okay. Surgery is scheduled to start at 7:30. They'll come get you from the room about 7 o'clock. Okay.
Okay.
Before you go downstairs, they're going to put a monitoring line in your wrist artery. That allows us to watch your blood pressure in real time
Okay.
during and after surgery, and that'll stay in as long as you're in the ICU. Okay.
I was gonna come and help her with her bath,
Okay.
the shower. So what time should I come? Like 6?
So usually they're waking her up about 5 to 5:30
Okay.
to do those type of things. So you may want to be here a little bit earlier than that. So is this your wheelchair or is this his wheelchair? Yours?
This is
Okay. How are you? How good at walking are you?
I was walking with a walker before, but just the last week, I think.
Hello.
Hello.
Hey, how are you?
Pretty good. They said your nurse call stuff
Okay.
wasn't working. so
Okay,
I-
perfect. They're getting you fixing your TV remote control.
Okay.
Over here.
Yeah. So they'll take care of that. You want me to unlock the bed for you?
No, we're good.
Oh, there it is. Right over there. I thought I put it here.
We're good.
So surgery will take several hours. Okay, we probably won't be finishing up till mid to late afternoon. Okay,
So if I come at 5,
I'm just
they'll let
testing
me
the
in.
nurse.
they should. So the door to building 4 sometimes is locked at
Okay.
that time, at that early in the morning. But if you come in through the door at building 5
Doing 5.
and then just walk down the hall, take the elevators up, that'll
Okay.
be just fine. Okay.
So just come up
Just
to
before you, just before you leave, just come right up to the floor, come to the room. Just before you leave today, chat with the nurse, let them know that that's
Okay.
that's what your plan is, okay?
Okay.
I have a question too
Sure.
now regarding when I take my medication.
Uh-huh.
So I still take it today, tonight.
So let me look over all the medicines you were taking at home. Most of them I will probably have you hold. Your diabetes medicines for sure.
The Lemonade.
Yeah, I'll put you on an insulin protocol here, and we'll leave you on that for the first few days around surgery, okay?
There's one of the pills, micros. I forget whatever. Anyway, it's in my bag.
Okay.
That he said to up my blood pressure because my blood
Your
pressure's
midodrine,
been-
yeah.
Yeah.
Yep.
So, do I take that?
So
'Cause he
what we'll
told me
do
3
is
times.
we'll take your blood pressure periodically through the day and night.
Okay.
And if you don't need it, we'll probably won't give it to you. But if your
Okay.
blood pressure dips a little low, we'll give it to you then.
So for now,
Okay.
I don't take any medication.
For right now, don't take anything. I'll write for the things I think you need,
Okay.
and then we'll just skip the rest. Okay.
Okay.
Some of those can be harmful right around the time of surgery.
Okay.
We don't want too low blood pressure going into
Yeah.
surgery. We don't want to do anything that's going to hurt you, obviously.
Okay.
Okay. I would anticipate being in the ICU for several days. If your heart is fairly weak after surgery, as we're taking you to the ICU, we may choose to leave that breathing tube in for a day or 2.
Okay.
If we do that, we'll start some sedation medicine to help keep you comfortable. Okay.
Okay.
We're still going to want to have you awake enough where you can follow commands to let you know your brain is working, get a little exercise while you're in the bed, those type of things. But we'll try to keep you comfortable. Okay. It doesn't hurt having that breathing tube in, but it can be kind of an anxious thing.
So I can't use a cane, right? Because of
We don't want you using a cane because with this incision and that,
pressure.
when we wire that bone back together, that bone is very fragile. So if you start pushing with your arms a lot, that bone can shift or separate. So using a cane, if you're just using it for balance,
Even the
can I borrow
water.
your cane for a minute?
yeah.
So if you're just using it like this to kind of help keep your balance, that's one thing.
No, I
But if
lean
you're
on it.
if you're leaning on it, that can really put a lot of stress on your
so
incision.
with the walker.
So same thing with the walker. Balance is good, but if you're leaning on it and pushing on it to try to help support your weight, that can separate this bone and cause problems.
So I'm gonna have to use my wheelchair.
We're going to try to get you up with the therapist. Walking after surgery is very good for the lungs and it helps you rehabilitate, okay?
Oh, okay.
We'll try to whip you back into shape after
How do I
surgery.
do that without holding on?
You'll have people walking with you, and they'll put a little safety belt on you and they'll hold on to that belt so you feel safe, okay? They're very good at their job, okay? They'll take very good care of you, all right?
Okay. I'm not gonna pull them down.
You will not pull them down.
Okay.
They could walk me and I wouldn't pull them down. They're pretty good at their job, so, okay?
What was not working? I
I
can't.
didn't even turn it on. I don't know who told you, but the
Oh.
nurse probably who came in here, came 2 of them.
Everything seems to be working, so
Okay,
should
perfect.
be good.
So I
Thank you
don't
for
know.
checking.
You bet.
I haven't touched it except to take it from her and put it down.
All right. Thanks.
Okay, thanks for coming in.
You bet.
So
Thank you.
I would anticipate, being in the ICU at least a couple of days. Okay, this is a big operation. You have some health issues, it might be a little slow for you to recover before we get back up to a room like this. She may not come back to this room when she leaves the ICU, so be sure to take all of her belongings with you, okay?
Okay.
And the more tubes and wires come out, the closer you are to going home, okay? Do you make any urine?
Very
Very-
little, and I made that little before I came.
Okay, do you make some on a daily basis or less than that?
Sometimes it's every other day.
Sometimes every other day, okay. Sometimes we put a bladder catheter in. It helps monitor your temperature during surgery and drain whatever urine you're making. So you may wake up with that tomorrow. Sometimes we choose not to do that.
So what is that?
It's a catheter that goes in your bladder to drain the urine out, okay?
So you operate on that?
No, it's just a tube that goes in there. It's not an operation, okay?
Because I got the,
You got your dialysis catheter.
Yeah.
We'll leave that alone,
okay.
okay?
Yeah, we had to have surgery to do it, so I was wondering if I had to do surgery.
Oh, no, much simpler than that, okay? The drain tubes that I talked about that drain fluid away from the heart and lungs, those come out right below your rib cage. They're about as big around as my pinky, okay? Once the drainage slows down, we're able to take those out at the bedside. Right next to that, we'll put some temporary pacemaker wires, little blue wires that'll come out through your skin. That allows us to control your heart rate, how fast your heart is going after surgery, okay?
Well, you control it.
We will control it for the first couple of days. Then we'll let your heart take over and do the trick, and then we'll take those wires out, okay? You won't go home with those, okay?
Okay.
All right? I just want to kind of give you...
Are those, you gotta,
Nope,
so
they just
close?
slide right out. So
how do you put it in? You gotta make
we
a hole?
we put them in during surgery, and it's attached to a needle that we
while
just
you're
stick through the
cutting
skin.
it open?
We have while we're open, we do that.
Oh,
Okay?
okay. That's good.
We-
Several of them.
We've got it all figured out.
Okay. I'm slow,
Okay.
so I have to
No, it's fine.
hear it all.
That's why we come to talk to you, so you
Okay.
kind of know what to expect. Okay.
Okay.
Now it looks like Dr. McKellar had a pretty good conversation about risks of surgery with you when you met with him in the office.
It'll work or it won't.
That's a good attitude,
That's all
right?
I have.
So the big things that we worry about: death, heart attack, and stroke. Your risk of any of those things happening is probably on the order of about 10%, maybe even a little higher. Okay. We worry about bleeding. Can't do heart surgery without having some blood loss. We'll have some extra blood set aside for you in case we need it. We also have a machine in the operating room that collects your blood loss. We're able to wash that and give that back to you, okay? We worry about infection. We give you antibiotics before, during, and after surgery to help reduce that risk, but the risk is not zero. Infection risk is a little bit higher in people that suffer from diabetes and suffer from kidney failure, so that puts that risk
I know
up just a
all
little
of
bit.
them is risks.
Kidneys, even though you're already on dialysis, you're on peritoneal dialysis. Sometimes when we do heart surgery, peritoneal dialysis becomes not an option and we have to switch to conventional hemodialysis.
How can how can you make sure that I absolutely cannot go on peritoneal again?
We don't know. That's not something that I can predict.
Yes, because I would like to go back on it if possible.
If possible, we will certainly get you back on that. We'll leave that up to a conversation with you and and Dr. Gopinath, okay?
Okay.
So,
I can see him after this.
yep, and I'm going to get somebody from his team to come see you while you're here in the hospital. Okay, so they'll be helping us with your kidneys all along this every step of the way. So if they think that the peritoneal dialysis isn't doing the job of cleaning your blood like it needs to, we can switch you to the hemodialysis with a temporary catheter. Okay, and then we'll go from there. Okay, we worry about blood clots. We give you blood thinning medicine both during and after surgery to help reduce that risk. We get you up moving around after surgery.
So is that medicine I have to take the rest of my life?
Depends on what kind of valve we put in. Most of the time when we put a tissue valve in, no. We'll just give you medicine while you're here until your mobility increases and the risk of blood clots reduces. If we use a mechanical valve, then yes, we would put you on blood thinner the rest of your life. Okay? My suspicion is Dr. McKellar has talked to you about a tissue valve that would not require a blood thinner. Those don't last quite as long in people that suffer from diabetes or kidney disease, but given the fact that you're a little frail and use a walker, you're at a little increased risk of falling, so that weighs into consideration when starting somebody on a permanent blood thinner, okay? So if he hasn't, he'll talk to you about that today before surgery, okay? I'm gonna go return this page real quick. I'll be right back, okay? We'll finish talking.